Hello everyone. Today let's discuss on unconjugated hyperbilirubinemias. This question can be asked for 5 marks as well as for 3 marks. So depending upon the marks, you can add up the points on each types of hyperbilirubinias. And if it is only for 3 marks, you can give a brief description on each one of them. If it is for 5 marks, you need to explain each one of them in detail. So first you can explain what is unconjugated hyperbilirubinemias. Hyperbilirubin means increased bilirubin level. Unconjugated bilirubin is increasing in the body. It is due to the increase in unconjugated hyperbilirubin. It is due to the defect in conjugation. Conjugation is not occurring and it is not being excreted as it is insoluble. So unconjugated or insoluble bilirubin is increasing in the body. The first example is Crigler-Najjar syndrome, that is due to the defect in conjugation. This Crigler-Najjar syndrome itself is in two types. Type 1, it is the congenital non-hemolytic jaundice due to the deficiency of UDP glucuronidase transferase enzyme, and it is often fatal, and children will die before the age of 2. Jaundice usually appears within the first 24 hours of life, and this unconjugated bilirubin level increases more than 20 mg per dl, and hence there will be the patient will be showing kernicterus results. And in type 2, which is not fatal or which is a milder form, only the second stage of conjugation is defective. Next hyperbilirubinemia, it is Gilbert's disease. Gilbert's disease is an autosomal dominant trait, inherited autosomal dominant trait, and it is the defect in uptake of bilirubin by the liver. Bilirubin level is usually around 3 mg per dl, and the patient is asymptomatic except for having a mild symptoms of mild jaundice. Next one is neonatal hyperbilirubinemias, that is in newborn infants. After the second day of life, there will be mild jaundice appearing. This is due to the accelerated rate of destruction of RBCs. RBC destruction will be more during the second day of life, and there is immature hepatic system. The liver will not be mature, therefore the immature hepatic system is not able to take up the load of destruction of RBC, and it is not able to conjugate the bilirubin, or unconjugated bilirubin is increasing thus. In such cases, bilirubin does not increase above 5 mg per dl and will disappear by the second week of life. Next type is breast milk jaundice. In some breast milk fed infants, there is prolongation of jaundice seen due to the high level of estrogen derivatives, which is derived from the maternal blood. This estrogen derivatives is excreted through the milk and it is reaching the infants. This would inhibit the glucuronidase transferase enzyme system, and sulfur and such other drugs will release bilirubin from albumin and is causing jaundice in newborns. Next one is hemolytic jaundice in newborns and in adults. First let us see in newborns. This is due to Rh incompatibility. Hemolytic diseases of newborn is due to Rh incompatibility. So first explain what is Rh incompatibility. That is the condition results from incompatibility between maternal and the fetal blood groups. Rh positive fetus may produce antibodies in Rh negative mother. In Rh compatibility, the first child may escape, and in the second pregnancy, these antibodies is passing from mother to the fetus, which is fatal for the fetus, and this would start destroying the fetal RBCs even before birth. Sometimes the child is born with severe hemolytic diseases, often referred to as erythroblastosis fetalis. When the blood level is more than 20 mg per dl, the capacity of the albumin to bind to the bilirubin is exceeded. In young children before the age of 1, the blood-brain barrier is not fully matured, and therefore the free bilirubin is entering the brain and causing severe deposition in the brain, and it is causing severe mental retardation and fixes, then toxic encephalitis and spasticity, etc. If the child develops hemolytic diseases, child may be given exchange transfusion along with phototherapy and barbiturates. This phototherapy is done with blue lights of nanometer ranging from 440 wavelength. Then this phototherapy is helping in isomerization of insoluble bilirubin to more soluble isomers, so that it can be excreted through urine without conjugation. Next one is hemolytic diseases in adults. This condition is seen in increased rate of hemolysis usually occurring in the adults, and features include increased unconjugated bilirubin in blood, absence of bilirubinuria, and excessive excretion of UBG in urine and SBG in feces. Then the common causes is GPD deficiency, autoimmune hemolytic anemia, toxins like carbon tetrachloride, etc. Thank you.